from Dr. Jessica Schorr Saxe, who's a family physician, retired after 34 years with that bloated healthcare industry we're talking about, where we can't even find out where the money is going. She practiced with the underserved, and now she is the chair of Healthcare Justice North Carolina, which promotes Medicare for all. So let's give it up for Dr. Jessica Schorr Saxe.
Good afternoon. I am here because every single day in practice, I saw someone who didn't get some kind of health care because they didn't have enough money. Some of my patients missed appointments because they couldn't pay for their visits. Some of them didn't fill their prescriptions. Some filled them and then stretched them by skipping doses, although you can't really control diabetes or high blood pressure that way. In our rich country, people don't get health care they need. Is that justice?
No!
I think not. In this country, about 30 million people have no health insurance. Another 41 million are underinsured, which means that even though they have insurance, they either can't afford to get care or they are sick and they get care and then they have bills that they can't pay. About 1 in 3 people in the United States doesn't get some kind of medical care they need, and about 1 in 3 people has trouble paying off a medical bill. Is that just?
No!
I don't think so either. We know that the United States spends about twice as much per person for health care as other wealthy countries. Yet our health is worse. We don't live as long as people in other rich countries. More of our babies die and more mothers die. And all of these numbers are worse for poor people. We know, too, that racism is a factor and that people of color have worse health than white people. Is that just?
No!
I don't think so either. It's not just getting health care that makes a difference to health. There are all those other things that help people be healthy. Poor people are less likely to be able to get healthy foods or clean water. They're less likely to be able to get exercise because they can't afford gyms, and their neighborhoods may not be safe for walking. Poverty is a stress, and stress affects immune systems, making people more likely to get sick. Is that just?
No!
I think not. Now, I remember the first Poor People's Campaign. I lived near Washington and I visited Resurrection City and I saw the people endure the rains and the mud and I heard them speak eloquently about their demands. And I had hope that that Poor People's Campaign would succeed and that we would end poverty. But now we're reconsecrated to that mission.
Yes, that's right.
Yes,
Right?
yes.
We must have clean water, air, and a healthy environment.
Yes.
We must have living wage laws.
Yes. Yes.
Medicaid expansion.
Yes.
Protection of Medicare.
Yes.
And single-payer universal health care.
Yes.
Access to mental health professionals in addiction and recovery. And immediate attention to policies that would end child poverty. And we must make this the last time we need a Poor People's Campaign.
Yes.